Hi everyone, we're back, and the topic for discussion is today the new nurse. Imagine being in this situation. And to learn more about it, you can go to dearnurses.org. Plenty of helpful topics. Here is the new nurse who is just starting her first day in the ICU. The night before, she didn't have much rest because she was so preoccupied, extremely anxious about having to work in intensive care. She walks in. Hardly has she even gotten her thought processes together, and then she hears a code blue called. Then she sees everyone rush off to this one room. Naturally, she's frightened, because what does she do? What is her part in this whole situation? But this patient that was coded ultimately winds up being intubated, but that's not the issue. The real issue is, if you would be placed in that situation, would you even know where to begin? Let's see if we can help you through that situation. Think of what it says, your critical thinking. And what is your critical thinking? Well, actually, it's the ability to think really fast and act fast and just connect the dots, or say, put the pieces of the puzzle together. And I know that can be a real challenge. Initially, when you get to a new place, it's always very frightening. So I've prepared other topics that can be of help to you. At dearnurses.org, hemodynamic monitoring, patient CPR, and easy EKG reading. These topics will be very helpful. Here are some important pointers. Suggestions. You gather when you first start your shift. It's important to have your plan of care, gather information, make sure that you learn about that patient, the history, the diagnosis, what the plan of care wants you to do, and of course take the time to familiarize yourself with the policies and procedures and doctor's orders. Next, I wanted to talk about a pulmonary artery catheter. That's something that you would likely see in an intensive care unit. Well, what is it exactly? It's a useful diagnostic tool. It is inserted into the heart. I'm simplifying it for you. It's used for conditions such as sepsis, pulmonary hypertension, myocardial infarction, vascular disease, and many, many more conditions. Anyhow, here is a patient, says he feels very tired, and naturally the doctor feels like they're going to put one of those catheters in. If you look down in the left-hand corner, you will see that it's being placed. They usually turn them in Trendelenburg position. Once it's put in place, the catheter, you have different waveforms, and if you go to hemodynamic monitoring, it's all there for you. Let's talk about the cardiac output, and the cardiac output is actually ordered by the doctor, and the tool that we use for doing it is this exact pulmonary artery catheter. And it really measures the amount of blood the heart ejects with every contraction. So the normal is usually 4 to 8 liters a minute. And then there are specific instructions written by the doctor, like taking care of the site. There are some additional ports which have to be kept clean, and the way they're kept from being clogged up after use. Another thing is, after it's put in place, the doctor usually orders a chest x-ray. Reason being, make sure that it's in the right place. Usually before the catheter can be used, it's very important that you get a chest x-ray. Doctor orders it, of course. Now I want to talk about surgical affairs. You might have patients going to surgery, or you might be that nurse. ICU sometimes is crossed over with like PACU, and so it's important to know what happens, like anesthetics the patients receive. And also there is a sheet there, a whole page on anesthesia. If you take the time to read, there is a lot to be learnt about the medications that are used, what you would expect if you were ever put in PACU and your patient had anesthesia and brought over to you. And there are ICUs, I've worked in ICU, where we've had patients, instead of going to PACU, they would come directly from surgery into ICU, especially